A common complaint we'll see from many of our patients almost on a daily basis is heel pain. The patient will come in and they'll talk to me and tell me that their heel's been hurting them for several weeks or a month, and they notice these symptoms after rest, particularly when getting out of bed in the morning. On an exam, I don't have to look very far. If you just push to the bottom of their heel, it almost brings them out of the chair. And this is because the band of tissue in the bottom of the foot that supports the arch is called the plantar fascia. And this band of tissue inserts on the heel, and it can be thought of as actually like a rubber band that connects the front of the foot to the back of the foot. And this is under tension. And it becomes real painful after periods of rest because it cools off and becomes tight, and you step down with those first few steps, and it seems to hurt the worst. We'll start off coming in, we'll talk about what the condition is, we'll talk a little bit more in detail, and then I'd like to start somebody off on an anti-inflammatory because it's thought that this portion of the plantar fascia is inflamed, and that's what's causing the pain. So we'll try to break up that inflammation with a prescription medicine, as well as talk about different exercises to do to go home with. And we like to send the patient home with a device that actually assists with this stretching, something that can be worn while resting or at night, and will actually hold the foot in a stretched position to relieve some of that tension on the fascia. This can cut the symptoms in half by almost 50% on a follow-up visit. Some other things that we can throw at this and we talk about, injections do work well, but most people aren't keen on getting that right away. But they do have their place and they work well. It can take 1 or up to 3 injections to see improvement, and that depends on the patient, depends on how inflamed it is. Finally, you can think of the second stage of treatment once the pain is improved, is preventing the pain from coming back to what it once was. And this is handled most often with the orthotic device that goes in the shoe. It supports the arch and actually takes the strain off the plantar fascia and tries to prevent it from pulling on the heel. Few people ever have to have surgery on this condition. Almost 90% or more gets better with simple conservative care.